How about this question is for Dr. Manapat. Sir, do we do cardiac surgeries on COVID-19 positive patients?
We don't usually do COVID positive patients because it has been found that the morbidity and mortality is high when you do surgery, cardiac surgery on COVID patients. Before, there was a study that came out. The mortality was as high as 34%. And then the risk of pulmonary complications was 94%. And so the recommendation, at least before this Omicron variant came about, was to wait 7 weeks after the diagnosis of COVID to allow for recovery. Because they found that the surgery is done 7 weeks after carried much lower morbidity mortality compared to those done before 7 weeks. I have had an occasion where I did an urgent CABG on a patient 4 weeks from CABG, from 4 weeks from the diagnosis of COVID. But since the patient was having a lot of chest pain, he was recovered already from COVID, but he was having a lot of chest pain. And so we felt that since he's recovered, we'll just go ahead and do the surgery. When he was okay, but the length of stay of the patient was prolonged because he developed pneumonia, and I think that's still part of it, because of the COVID diagnosis.
Thank you, sir. So it's really a higher risk, comes with a higher risk. Next question is for Mr. Pang. Sir Pang, did you have any experience wherein you encounter a failing oxygenator during cardiopulmonary bypass? And how did you go about it?
Oh yes, I have many experience when it comes to failing oxygenator, especially if the procedure is prolonged or procedures that cannot be weaned from the cardiopulmonary bypass. So once the oxygenator is failing, you have to replace it with a new oxygenator. So it's very cumbersome to do that. At least you need 2 perfusionists in order to have a faster time of replacing the oxygenator. So there's a lot of blood splashing if you're going to do that. So what we're going to do is we're going to tell the surgeons that we need to replace it, and then surgeons will going to command us to turn off the cardiopulmonary bypass in order to replace it. So for me, the recommendation, you need to have 2 perfusionists to have a faster time of replacing it.
What's the fastest time that you can do it, Sir Pang? Exchanging oxygenators, replacing it?
Actually, there's no recommendation to the amount of time, but you need to the faster you can do it, the better.
Okay. This is the last question for Dr. Manapat. Sir, what's the acceptable time for cardiopulmonary bypass and cross-clamp time during open heart surgery?
Of course, the rule is the shorter the cross-clamp time and bypass time, the better for the patient and overall long-term, result and complications will be less if we shorten the operation. So maybe if you can keep it around 2 hours cross-clamp time, or at the most 3 hours in bypass. But how long is the maximum? Of course, if you go by the standards that are set for transplant, a patient who is receiving a transplant from a donor, usually the ischemic time that is allowed is about 4 hours. Okay. So that means the time that the heart was harvested from the donor to the time that was to the time that it's implanted and is functioning in the recipient. That maximum is about 4 hours. There are some centers experimenting with longer than that, but of course, longer than that is really the prognosis and complications go much higher.
Thank you very much, sir. So the longer you stay on cardiopulmonary bypass, the greater the consequences and even the end organ damage that the patient can have. Last one more question, Dr. Manapat. Do we have chance for pig heart transplant here in the Philippines also? Is there a future for that?
Actually, that might be, if it becomes commonly practiced, that might be a better option than human heart transplant, because the logistics, I suppose, would be less. But of course, we have to have a way to develop this genetic modification of the pigs. It cannot be just any pig. It has to be a genetically modified pig.
Thank you, sir, for that. So thank you very much, Dr. Adrian Manapat and Mr. J.R. Pang, for sharing with us your experience and knowledge on open heart surgery and cardiopulmonary bypass. So indeed, open heart surgery is a coordinated and consolidated team effort with the whole cardiac team, and surely one cannot do without the other. That is our cardiac surgeons, our cardiologists, our cardiac anesthesiologists, our perfusionists, and the cardiac nurses, as well as the whole post-operative care team. So its success depends on the whole communication of the whole team and the effort of each one. Thank you and have a good day, everyone.